Hello, my name is Nadine Kaslow, and I'm the 2010-2011 President of the American Board of Professional Psychology, also known as ABPP. I am board certified in 3 of our 14 specialty areas: clinical psychology, clinical child and adolescent psychology, and couple and family psychology. I'm honored to have this opportunity to share with you some information about ABPP and the value of board certification. Competence in one's profession is expected by oneself, one's peers, and the public. Like all healthcare professionals, psychologists abide by a set of ethical principles and codes of conduct that address consumer protection and that state that one should practice within one's area of competence. We have all come to recognize competence in physicians and other providers by their board certification status, and we choose to seek them out based on their being board certified in a given specialty. Increasingly, professionals and consumers have sought to identify competent psychologists within a specialty area. There is a shift occurring professionally from a time when board certification was viewed as only for the cream of the crop to becoming an expectation for all psychologists demonstrating competence in one or more specialty areas. It is expected that board certification by ABPP will eventually be considered an expected step in the professional development of psychologists following specific education, training, and licensure requirements. To be certified by an ABPP board in a specialty, the psychologist must demonstrate both generic and specialty-specific competence in the foundational and functional competencies within professional psychology. Specifically, foundational competencies refer to the knowledge, skills, attitudes, and values that serve as the foundation or the building blocks for the functions a psychologist is expected to perform. These include professional identity, individual and cultural diversity, ethics and legal foundations, and interpersonal interactions. The functional competencies encompass the major functions that a psychologist is expected to perform. The functional competencies include assessment, intervention, consultation, science-based and application, and supervision, teaching, and management. These competencies serve as the basis for the competency-based examinations that are required for board certification in a specialty through ABPP. Our 14 specialty boards differ somewhat in what is required for board certification. All boards require a written work sample and an oral examination. Some boards also have a written examination. I chose, personally, to be board certified for a number of reasons. Probably first and foremost was the intrinsic value related to personal growth. There's no question for me that going through the process of board certification and becoming board certified was very personally gratifying as well as professionally meaningful. I believe that for me and for many of my colleagues, being board certified through ABPP gave me a mark of a specialist and helped to document my professional identity as a specialist to the public as well as to myself. And I think for all of us, it helps to differentiate us from other psychologists who are practicing. In addition, I work in a healthcare system where board certification is without a doubt considered the minimum standard for the provision of quality patient and client care. I also think for me that I found it quite useful to go through the peer review process, to have my peers review my work, engage with me in a meaningful dialogue about it, and to offer me constructive feedback that I think helped facilitate my growth and development as a professional psychologist. As an educator and trainer myself, I think it's essential that I serve as an effective role model for the practicum students and graduate students and interns and postdoctoral fellows that I teach and supervise. I think that being board certified in a specialty enables me to be a better role model to my students. When I speak with my colleagues and my peers and my friends and my former trainees about their reasons for seeking board certification, these are some of the answers that they give me. They found that being board certified through ABEP has given them a market edge for jobs. Some insurance companies are requesting board certification status for somebody to be impaneled. Increasingly, people are finding that it's becoming essential for hospital privileging. In other words, to be privileged to practice a specialty in a hospital, one needs to be board certified in that specialty. ABEP provides a series of online resources for referrals, so the people who are board certified both are able to get more referrals and to make referrals throughout the country. In some settings, my colleagues have received a pay bonus for being board certified, and of course, this is very helpful to them. In other settings, being board certified in one or more specialty areas has helped facilitate people's promotion and tenure process. For many people, when they want to move from one state to another state, licensure is a challenge. Being board certified through ABEP helps to facilitate mobility in many jurisdictions. In other jurisdictions, continuing education credits are awarded during the time frame in which somebody obtained their board certification status. These credits can be very helpful to people. Increasingly, in our country, consumers of health and mental health services are asking about the board certification status of their psychologists. And of course, they can identify board certified psychologists online. These are some of the many reasons in which I believe it's essential for people to become board certified and helpful for them to do so. On behalf of the American Board of Professional Psychology, we are seeking diverse professionals to join our family and to join other leaders in psychology to define excellence in our field and our profession. There's no question in my mind, this is the future of our profession. I sincerely hope you will seek board certification. Please feel free to contact the ABEP Central Office or any board certified psychologist, as we are happy to answer your questions and facilitate this process. Thank you and good luck.